So sometimes some of the most confusing parts of stroke recovery isn't even actually the stroke itself. It's literally trying to figure out, what services, programs, therapy options, community support services are actually available to you. Most people only hear or are educated about whatever the next step is in front of them. So today I want to talk to you about and walk you through the entire continuum of care after stroke and explain what these services are, who they're for, and when they might make sense for you or not. Now, the very first phase is like it's considered the hospital phase. This is like the acute care hospital. You probably went to the ER, they admitted you to the hospital because of the stroke, right? The focus here is just medical stabilization. They're trying to stabilize you. They're doing testing, looking at medications, monitoring you. There's usually not a lot of therapy or rehab happening yet, but you may be getting a few short sessions a few days a week. The goal here is really kind of trying to determine what's going to happen next. Now, the highest level of rehabilitation available after stroke is considered inpatient rehabilitation. This is probably going to be your most intensive rehab setting. It's almost always 3 hours of therapy per day, and it's some mix of physical therapy, occupational therapy, and speech therapy. It's overseen by a physician. There's a really strong focus on returning home, and it's usually 2 to 3 weeks. It's great for people who are able to tolerate intensive therapy this early after the stroke. It's for individuals with really good recovery potential, and you've got to be medically stable. Okay, a more moderate level of rehab would be what is considered a skilled nursing facility. Now, this facility will provide rehabilitation, but also nursing care. Therapy is generally less intensive than an inpatient rehab. It may be more appropriate for those of you who cannot tolerate intensive rehab that 3 hours a day. It's often a longer length of stay, and it's better for folks who are still pretty medically complex. If you're needing ongoing nursing care at this stage still, and again, you're just not quite able to tolerate those intensive rehab schedules. Now, long-term care, this is more like a nursing home setting. The focus primarily on long-term care nursing and personal care needs, not primarily rehab, but there is rehab there if it's ordered, may provide some therapy, right? This is good for those of you who are requiring that kind of ongoing 24-hour care and are dealing with pretty significant physical and or cognitive deficits after the stroke. Now, assisted living options, and again, these may be typically more appropriate for older adults who have had a stroke and are not able to return, home safely, and families not able to provide that longer term care or supervision they need. Traditional assisted living facilities have on-site assistance with like medications and meals and those daily living things like bathing, dressing, and grooming if they need it. Um, and they give you a little bit more independence as a resident than you would have as like a patient in a nursing home. Now, there is another aspect of assisted living which is considered residential assisted living, and it's becoming very popular. It's more in a home-like setting. There's usually fewer residents depending on, the size of the home. You get much more individualized attention. And again, like I said, it's really growing in popularity because of the more natural and comfortable home environment. You don't feel like you're in a facility. And there are actually options for what is being called luxury assisted living or residential assisted living. It can definitely be more expensive, and the good ones for any assisted living is going to most definitely have a wait list. Now, luxury assisted living is going to offer the same services. You can get therapy, assistance, private accommodations. You usually will get more expanded, like recreational activities or transportation out to the community and to appointments. Definitely better quality food, meals, that kind of thing. It's going to feel like you're living in a community. You can have your privacy, but you can have that social interaction too. Now, personal care homes are a little similar. They can vary by state. You're going to get assistance with daily activities as you need them. They're definitely a much more smaller, but still a home environment, and usually it doesn't have to be, but it can be in a residential neighborhood. There's often less medical oversight. You may have to have some shared spaces like sharing a bedroom or a bathroom, but some personal care homes do offer the option to have your own space. Now, if you're able to return home after a stroke, either straight from the hospital or after a few weeks in an inpatient rehab or like a skilled nursing facility, you have some additional options to consider to continue your therapy. And home health therapy is one. You can get PTOT speech. They come to your home. They're typically shorter visits. They're kind of get in and get out. You must be considered homebound to receive home health services. The focus is mostly on safety and kind of maintaining independence. It's usually good for folks who, again, you're considered homebound, so it's hard for you to get out the house. You don't have transportation. It would cause you undue stress to do so. Some may also qualify for a home health aide services. This is also through home health companies, and they will help you with bathing, shower, dressing, sometimes light cleaning, sometimes even meal prep. But these services are very time limited, so it's not for forever. Okay. Other home supports can be in-home caregiver services, which would provide assistance with daily activities, maybe just companionship, someone to just kind of hang out with you or your loved one. They can do meal prep, provide transportation. But again, there's a financial piece here. It's either provided, your family can provide these services for you, you can go through an agency, and then you just private pay, right? And again, that's just going to depend on what resources you have available. Same for private duty caregiving. You can hire directly through an agency. Usually you can have flexible scheduling. It can range from just a few hours to full-time care. But again, it depends on your resources. It can be a great option. It's kind of ideal. You want to stay in your home, but it's an expensive long-term situation if you don't have the means to continue it. There are caregiver waiver programs. They will vary. They're not always available in every state, but they typically will allow a family member to be paid for providing caregiver services for their loved one at home. The eligibility is going to vary, so it's really important to do your research and look into programs. Check with your case manager or social worker for more information, especially if you're still in the hospital or the rehab facility, because your case manager or social worker can be a really big help providing you with resources and kind of helping to point you in the right direction with some of these questions you may have. Okay. Now, not as well known an option for a more intensive, higher level therapy at home is in home outpatient therapy. Um, it's outpatient therapy. It's like an outpatient level quality of therapy, but it's delivered in your home. So it's often longer sessions. You get much more intensive therapy. The therapists still come to your house. They may bring some like mobile equipment with them if they need to. The focus again is still going to be on continued rehabilitation, regaining strength, improving balance, coordination, independence in the home, with your everyday tasks. And again, it's a great option if you have limited transportation, if you just don't do well getting out of the house, it's physically fatiguing, or you just in general do better in your own home. And you obviously also, if you still have some mobility challenges getting out, then it can be a great option. Now, more community based options can include things like obviously a more traditional outpatient therapy clinic where they usually will offer PT, OT, or speech in a clinic setting. Often the next step after home health for a little while, people will try for outpatient. And it's kind of gold standard because you have access to equipment and all of that, but you have to drive yourself in for all your appointments several days a week or have someone else take you for each appointment if you're not able to drive yet. And the transportation piece here is usually the biggest hurdle for most people. So looking into in-home outpatient therapy can really be a great option. Now, in some cities, you may also have access to some additional more specialty outpatient programs like specialized neurorehabilitation hospitals that may have their own inpatient and outpatient and day program facilities. There can be a stroke specific treatment programs at some of these more specialized hospitals, Parkinson's programs, balance, vestibular programs, things like that. And there also may be specialized driving programs that will offer like driving evaluations, simulated and on the road driving training. After some kind of neurological injury, they'll go over options with, for like modified vehicles, driving with like adaptations, like using hand controls, modified steering and pedal modifications, things like that. There are also what you'd call a specialty day program that can also be an option if they are available in your area. There is usually structured rehab and therapy during the day. It's multidisciplinary, so the OTPT speech, sometimes recreation therapy, plus a big focus on like social engagement and what we call community reintegration. So finding and teaching safe and independent ways to get back out into the community and live a full life. Some other community support services that may be available are things like adult day programs or clubhouses. Now, these can provide a safe place to go during the day for those who maybe have some cognitive impairments and need some supervision during daytime hours. Some focus more on just socialization or engaging in, purposeful activities and providing mainly relief for caregivers and families. And again, it can be great for those individuals who need that supervision and are just not safe to be on their own at home during the day right now, and families have to work, right? So that could be an option. And along those lines, some communities will offer what we call respite services. And again, depending on where you live, but these are geared more towards, again, providing temporary relief for caregivers. So offering short-term care support. So caregivers can, drop their person off. It gives them time to rest, recharge. So it can be used for just a few hours here and there as needed. But again, you have to kind of see what's available in your area. Now, independent living facilities. Now, some of these typically are more geared towards older adults or seniors, but they are designed for individuals who are still very independent. You get to live in a community environment without the stress and headache of kind of like that outside home maintenance piece and all those responsibilities. You get much fewer services because you don't need it. You're usually very independent. And again, it's good for those who are wanting a maintenance free lifestyle, and for those who are independent and don't require a lot of day to day assistance but can't be in their home. So if you have a parent, this could be a good option. They don't need assisted living, but their home is too much. On the other end of that, long term care or long term care placement is going to be more for individuals that are going to require long term ongoing support, medical care, supervision, you know, may need, and then it's also when home care, you may have tried home care for a while, but it's just not feasible to pay for someone to be at home anymore. Um, I know that's a lot, right? But the most important thing I want you to take away from all of this is that there is often more options available than people realize. We don't share, we don't talk. People aren't clued into a lot of this. Every stroke survivor situation is going to be different, and the best option is going to depend on a lot of things: your medical needs, your support system, your goals, your level of independence, your insurance, and obviously what financial resources you have or don't have available to you. So that's the reality of it. So please just don't be afraid to ask questions, advocate for yourself, explore every resource that might potentially be available to you. The more informed you are, the better decisions you'll be able to make, and the more confident you'll feel with your choices. Okay. If you have any questions at all, I know this was a lot, or if you have used any of the services we talked about today, leave me a comment and let me know. I would really love to hear about your experiences, how things are working out for you. Okay. As always, I hope this was helpful and I will see you guys next time. If you found this video helpful, don't forget to subscribe for more DIY videos to help you along the way in your stroke recovery. Struggling at home? Have a question? Leave me a comment. I'm here to help.